Hi, I'm Jess Port, the Child and Family Program Manager for the Mental Health Association of Maryland.
And I'm Angie McRae, Child and Family Engagement Manager at the Mental Health Association of Maryland.
And today we're going to be discussing the Safe Sleep Assessment Tool.
The Safe Sleep Assessment Tool is designed to help you identify families who are most at risk for sudden unexpected death in infancy as a result of unsafe sleep practices. You'll be able to identify associated risk factors and offer feedback and suggestions. Complete the tool together along with the caregiver and use it as a guide for your conversation about safer sleep practices. Observing the sleep practices is a key element to assessing the risks.
We strongly recommend that before using this tool, you view the videos and become familiar with all the material on the Safe Sleep website, healthybabiesbaltimore.com. We are about to screen a video that deals with a sensitive topic. It does talk about infant death. If that is something that you think might be triggering for you, please take a moment to take care of yourself.
I'm Ayana Williams. I have one daughter. She's 12 years old, and I had a younger son. He would have been 11 months old. His name is Brandon Lawson.
My name is De'Ara, and I live in the northern part of Baltimore. I have a husband, 3 children, 4-year-old. His name is Eugene. I have a 1-year-old. Her name is Sanaya. And I had a baby boy. His name is Charlie.
My name is Lottie Plumley. My son was born in Baltimore, Maryland on November 12, 2009. My son's name was William Woodward.
I basically got a phone call from another family member that was living in the house that the ambulance was at the home trying to resuscitate the baby and that they were rushing him to Hopkins. He was not in his crib. He was in the bed, in our bed.
When I woke up at 4:30, he was gone. We had found him dead in the middle of our bed.
On December 29th, Charlie passed away. He turned a month that day. That morning, he was in the bed with us. And when I woke up and looked over at him, he just wasn't breathing. If I had a chance to go back to December 29th, knowing what I know now, I probably would have changed a lot of things.
It's important to make sure your baby is always sleeping alone, on their back, in a crib, and never around any smokers. So that means your baby shouldn't be sleeping with you or anyone else. When they're asleep, you want to make sure they're always on their back, in a crib at all times. So that means an empty crib, most importantly. So no heavy blankets, pillows, stuffed animals, or anything like that. And then you want to keep them in a smoke-free environment from any type of smoke.
You could possibly roll over the baby, your arm, or the brother and sisters could, put their arms in the windpipe and could suffocate, or the baby could possibly roll over to the side and not be able to get any air.
It's okay to share the room with your baby, but not your bed.
Baby is more likely to choke when sleeping on his or her stomach. This is because when a baby sleeps on its stomach, the airway is below the tube that carries food. So if he spits up, any food or liquid can easily spill into his airway and cause him to choke. But when the baby is on his back, then the airway is above the food tube. Any food or liquid that is spit up cannot get into his airway.
A safe crib should have absolutely nothing in it but the sheet, a mattress, and absolutely nothing else. No blankets, No bumpers, no bears, no toys. Nothing but the baby, the sheet, and the mattress.
Each year, we provide about 100 families in Baltimore with safe cribs for their babies. We come into your homes, we'll set up the cribs, and we'll make sure you understand how your baby should be sleeping. You want to make sure you don't smoke around your baby or have anybody else smoke around your baby as well. Be the voice for your child. Make sure there's no smoke around them at any point.
I know a lot of times older people do things the way they did it when they were, raising their children. And, you just sometimes kind of have to let them know, this is how I want my baby to sleep, or, this is where I want him to sleep. This is what I prefer for him or her. It's your baby. You have to let them know what you want for your baby. At the end, it's if something was to happen, you have to live with it, not them. You can never replace that child that you lost, ever. And you'll never ever forget it. Something you have to live with every single day, to wake up and your arms be empty, or your home is missing a child, or you'll never be able to have grandchildren from that one child, or it's something you can never change it.
I never expected this to happen. I don't think any mother really does. I haven't really hit the big milestones yet, like his birthday, which is coming up, the year anniversary.
I finally went to go visit Charlie's grave for the first time yesterday. Having to look in the ground for something that symbolizes where my son is, where his body is. That was hard in itself. And then finally finding it and seeing his name on this headstone, my son. It was so hard.
I would tell other mothers just to really do what everybody says, because I really, really, really don't want this to happen to anybody else.
It's something no one should ever have to experience, because it's the hardest thing to get through. I really miss Charlie, and I'll always love him with all of my heart. My love will never change for Charlie because he's my baby. I really, really love my son.
When you complete the assessment tool with the family, remember this acronym, LOVE. L is for listen. Listen with empathy as the family describes their current sleep practices. O, ask open-ended questions. Ask the caregiver what they like about some of their not so safe sleep practices. V, validate. Acknowledge the family's desire to do what they believe is best for their baby. And E, education. Offer information to educate the caregiver and, if possible, provide specifics regarding the baby's situation. For example, risks associated with babies born prematurely. While any infant in an unsafe sleep environment is vulnerable to death or severe disability, some circumstances contribute to creating increased vulnerability to some infants.
Some of those risks are low birth weight, respiratory illness, prematurity, under 6 months of age, smoking and or other substance use in pregnancy, or a fussy, colicky, or difficult to soothe infant. Some more risk factors are smoke exposure, prone or side position, soft surfaces and bedding, surface sharing, caregiver drug or alcohol use, overheating, and the caregiver's mental health condition.
Here's some questions to consider when you're talking with the family about possible external stressors. Does anyone in the household or anyone who cares for the baby smoke? Do you ever take your baby to bed with you? Do you share your bed with anyone else, including pets? Does anyone in your household or anybody who cares for the baby drink alcohol or use drugs? Is any primary caregiver experiencing extreme stress, mental health decline, or challenges? Is the baby always put to bed on their back? What does your baby sleep in? Is the family able to ensure room temperature stays around 72 degrees? And do you have a plan to manage safe sleep for your baby in different circumstances? For example, sleeping away after home. And remember to ask these questions with love.
We're going to do a quick practice of what this conversation might look like. And while you're listening, feel free to look at the questions here of how the care worker established rapport and whether or not they sounded empathetic and non-judgmental. Okay, Angie, I'm going to go over a few things with you to learn a little bit more about Micah and ensure that he is safe at night when he's napping. Feel free to ask questions as we go, and afterwards, I'll give you some more info on safe sleep. Can you tell me a little bit about Micah's birth? Was he born close to his due date?
Yes, he didn't want to come out. He was actually 2 days late.
I bet that was a really long 2 days. Do you remember what he weighed at birth?
Yep, almost 8 pounds.
And how old is he now?
He'll be 3 months tomorrow.
Has he ever had any trouble breathing or respiratory issues?
Thankfully, no, he hasn't.
And has he been fussy or colicky or just generally difficult to soothe?
No, everyone tells me he's an easy baby, but he's my first, so I really wouldn't know.
So this question is a little sensitive, but we do have to ask everyone. Did you use alcohol or any other substances while you were pregnant?
No, not even a single glass of wine.
Sounds like you take your baby's health very seriously. Does anyone in your household or anybody who cares for Micah smoke?
No, it's just me and my mom here, and she quit smoking when I was a kid.
What about drugs or alcohol? Does anyone who cares for him use those?
My mom does have an occasional glass of wine at night.
Okay, thanks. Do you ever take Micah to bed with you?
Well, not at first. I always lay him in his crib, but I'm breastfeeding, and sometimes it's easier to bring him in bed with me to nurse.
Okay. Do you ever fall asleep while nursing and then he stays in the bed with you?
Occasionally. I mean, it happened a few times, but I try to put him back in his crib.
As you know, it's safest to have him in his crib. You can set an alarm on your phone to vibrate when it's time to put him back, or maybe turn on the TV so it's harder to doze off while he's in the bed.
Those are good ideas. His crib is right next to my bed, and he usually stays asleep when I put him back.
Do you share your bed with anybody else or maybe a pet?
No, it's just us.
Being a new parent is really tough and it can be overwhelming at times. How have you been feeling since he was born?
It's really nice to have someone ask about me. I'm okay. It is hard at times, but my mom helps a lot. She watches him when I'm at work during the day.
And how does your mom seem to be feeling?
She loves being a grandma.
That's great. When you or your mom put him in his crib, is he always placed on his back?
When I put him down at night, yes. But when he naps, my mom puts him on his stomach sometimes. I told her not to, but she says that I always slept better on my belly as a baby.
We've learned a lot in the last 20 plus years about safety. It's essential that Michael be placed on his back for sleep, even for short naps. I'm going to leave you with some more info that you can share with your mom. I'm sure she wants her grandson to be safe. Do you think she'll listen?
I think she will. I'll show it to her.
And what does your baby sleep in?
He has footy pajamas. I don't keep anything in the crib like blankets or bears because I know that's not safe.
Great. What about like a crib bumper or a blanket?
No, it's just him.
And what temperature is your room at bedtime?
We keep it really cool, around 70 degrees.
That's perfect. And remember, if you're comfortable in that temperature, so is he. Have you thought at all about when you may travel and where he'll sleep then? Or if you had some alcohol at a party and it wasn't safe for him to be with you?
I work too much to travel or party, but if we did go somewhere, I'd bring his pack and play for sleep. And if I go out, my mom will take care of him at night.
It sounds like you've thought a lot about him sleeping safely. You're doing great. We like to use the acronym the ABCDs of safe sleep to remember the most important parts of sleep. They stand for A, alone, B, back, C, crib, D, don't smoke. You're doing all of these things to ensure that Micah stays safe while sleeping. I also have some resources to share with you and your mom as well.
Thank you.
Okay, thank you so much.
What to do next? Check whether the family knows what the safe sleep advice is. Check their understanding of the advice and why it's so important to follow it. Be prepared for pushback.
Take a moment. What is something you think you may receive pushback on? How can you respond in a way that's validating, but also supports best practices? I don't want my baby to sleep alone. I like her close to me. Unfortunately, co-sleeping is really dangerous. Remember, it doesn't take much for a baby to suffocate. Co-sleeping is a common practice in some cultures. While it's wonderful to preserve most cultural traditions, some need to be adapted. Sharing a room with your baby is a great alternative to keep her close and safe. Won't my baby get cold without a blanket? Dress your baby in a sleeper for warmth, but don't use blankets or allow your baby to get too warm. Overheating can be a risk for SIDS. A good rule of thumb is to dress your baby in the same number of layers that you're wearing. If the room temperature is comfortable for you, then it's also comfortable for your baby. The goal is to reduce the infant's risk of sleep-related death by sharing information with the family about the ABCDs of safe sleep. A for alone, B for back, C for crib, and D for don't smoke. There are parents who are going to choose to continue to share a bed surface with their baby. So there are 3 factors in particular that heighten the risk of death. Bed sharing when the parent's alertness is impaired due to fatigue or medications, if the parent is a smoker, or sleeping on a soft surface like a couch or an armchair or even a waterbed. Other important reasons for safe sleep practices, in addition to the baby's safety, is that the baby might not learn how to fall asleep on their own. It can develop anxious behaviors, poor sleep quality for the caregiver, and limited space for intimacy with you and your partner.
So what can we do? Offer an alternative. Room sharing is a safe solution for caregivers who might be accustomed to co-sleeping. But even when co-sleeping, remind them to adhere to other safe sleeping practices. We want to ensure we address their questions and concerns. If you're in the home, assess the sleep environment and identify steps the family can take to create a safe environment. For instance, suggest moving the bed away from the wall and arranging furniture to place a crib near the bed. Identify where to store items that might have been previously in the crib. Help avoid inadvertent bed sharing remove pillows and loose bedding, set alarms, engage in activity. Then also share with the caregiver some strategies for soothing a fussy infant. Encourage them to seek solutions for a colicky or hard to soothe infant, and also provide resources for substance use and mental health treatment.
No, many families are overwhelmed with many systems and services involved in their lives. So when introducing a new service that may be helpful to them, such as a home visit, be sure to discuss with them how these services can complement and coordinate with other providers that they're already working with. And here are some provider resources and some more online resources. Thank you so much for joining us today.
Thank you. And if you have any additional questions, please feel free to reach out to the Mental Health Association of Maryland at mhamd.org.